everyone. Will those of you between the ages of 16 and 25 please stand? Alright, well, according to the Schizophrenia and Other Related Disorders Alliance of America's website, published recently this year, 75% of those diagnosed with schizophrenia are done so between these ages. Please be seated. My name is Blakely Mormon, and I am a neuroscience major and have done extensive research on this topic. Schizophrenia is a chronic mental disorder that affects many in the United States. However, with proper care and treatment, these people have the potential to live lives just like you and me. Today, I am going to inform you all about schizophrenia, its causes, its symptoms, and some treatment options. First, I will talk to you about what schizophrenia is and its causes. According to a personal interview with the neurologist Dr. Tad Seifert, schizophrenia is a neuropsychiatric disease that affects many in the early stages of adulthood. Schizophrenia may cause those who suffer from it to feel disconnected. This is why many people associate schizophrenia with being crazy or delusional. Sometimes even those who are schizophrenic receive misdiagnosis of being bipolar or having a dual personality disorder. However, this is not the case. Schizophrenia is associated with both genetic and environmental factors as well. Although there is no known cause for schizophrenia, some genetic factors that contribute to the disease are mutated DNA being passed down from parent to offspring. So no, there is not a schizophrenic gene that you can get from your mom, but there is the type of DNA that can be mutated and cause chemical imbalance in your brain. This is what makes people more prone to schizophrenia. Some environmental factors that may cause schizophrenia are viruses and social isolation, according to Nicholas Myers and James McAbee in 2016. Now that you know what schizophrenia is and its causes, I'm going to share with you the symptoms of schizophrenia. According to the National Institute of Mental Health, published in 2016, schizophrenia symptoms can be broken down into 3 categories. These categories include positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms do not mean that something good is happening to a person. What that means is that something is being added to a person's life. So these symptoms include hallucinations, which is seeing something that is not there, delusions, which is thinking something that is not true, movement disorders, and thought disorders. Negative symptoms are when something is taken away from a person's life that causes them to not be able to function the way they did before. These symptoms include the flat effect, which is being apathetic, depression, not being able to speak and not being able to connect with people, and being unmotivated. The third category of schizophrenia symptoms is cognitive symptoms. These symptoms affect more the way that you think and the way your brain works. So these symptoms would include not being able to start something and not being able to stop something. Also, not being able to apply information that you recently learned. And finally, thinking something is one way when it's really not, and making poor decisions. So now that you know the symptoms of schizophrenia, I'm going to tell you ways that you can treat them. According to the doctors at the Mayo Clinic as of October in 2016, schizophrenia can be managed in 2 ways because there's not a cure, so you have to manage the symptoms. One way is through medication. Medication can consist of anti-anxiety drugs, antipsychotics, antidepressants, whatever it takes to balance the brain chemistry. It's important that those who are taking medication stick with their medication because if they don't, then they may re-experience symptoms. Another form of management for this disease is therapy. Therapy really helps those with schizophrenia to cope with their disease and gives them the potential to live as normal lives as possible. Oh, I'm past 4 minutes, but thank you.